Hello, my name is Debbie and I'm a practice nurse in London. Today I'm going to be discussing how student nurses can overcome the hierarchical system in nursing. Now, as a disclaimer, this is not to bash the system or to put down anybody, because people work really hard to get to the position that they get to, but just to help student nurses who feel that they're not too sure where they fit in into the hierarchy. And I know hierarchy can sometimes seem like a bad word, but it's just a word for structure of, the way the nursing system works. Before I go on to the student nursing side, I'm just going to explain how the hierarchy system works, mainly in the hospital setting and pretty much in nursing in general. So it really works in bands. Majority of the time you start with healthcare assistants, which start at about band 2, band 3. No qualifications per se needed, just a passion and a drive for healthcare and everything else you learn on the job. And you can do a care certificate, so that is something that you can get out of being a healthcare assistant. So that's about band 2, band 3, and then you go to band 4, which is the new role as a nursing associate. So they are there to help the nursing team, and they also go on to getting a qualification to become a nursing associate. And then you start band 5 as a staff nurse. This is the entry level for nurses. You've qualified, you've gone to university or whatever route you've decided to take into nursing, and you are now a band 5 nurse. Then there's band 6, which is junior sister. So they are in charge of you. They're almost like team managers, team leaders, who are in charge of the team on the floor. They generally don't always have patients to look after. They're making sure that the teams are working effectively together. You have band 7s who are senior sisters, so this is more of a managerial role, so you're less patient focused, more staff focused. You're making sure there's enough staffing, you're making sure things like annual leave, just management in general. And then within band 7, of course, there are the patient focused roles such as specialist roles, diabetes nurse specialists, respiratory nurses, hematology nurses, a nursing role where you have specialized. Those are also band 7 roles, infection control, which within those roles you can then progress and become band 8. In a ward setting, for example, band 8s will be the matrons, so they attend the meetings. This is serious managerial positions where they oversee not just one ward, they could be overseeing a whole wing of a hospital. And then after band 8, you have more of the director roles, the nurse lead, the head of nursing roles, clinical lead roles, and things like that. So there's a lot going on. And then you have student nurses, and you almost think, where do I fit into this whole system? Because you know that you're training, so you know you're not a band 2, you're not a band 3, you're not really getting paid for what you do, so you don't really fit into the banding system. And sometimes, at least for me, I felt like I didn't really have a say because I'm not per se employed. And it can be a bit frustrating because you have, for example, healthcare assistants who have been in their role for 10-20 years, and they could pretty much do the nursing role, to be honest. If not, they don't have the qualification that they need to do the nursing role. And you're in uni and you're learning, but they pretty much know more than you. So it's almost like having to know your place in terms of, yes, you are studying to become a band 5 and then more, but at the same time there are people there who know a bit more than you. So I think when you're a student nurse, you learn things like delegation. You learn to understand that, no, you're not a healthcare assistant. This is something that I struggled with when I was doing my nursing course for, and I wasn't too sure what I was supposed to do. Was I supposed to work as a healthcare assistant? Was I supposed to work as a nurse? Like, there was this middle grey ground that I wasn't too sure about. Do I make the beds or do I give medication. And as a student nurse, that can be very frustrating and very difficult to know your place. But as you go on in this, you'll realize that it's a whole team effort. There will be times where you have to make the bed, and there'll be times where you're going to give the medication. You know, it's almost like not seeing. You have to try and make a blurred line in terms of, you know, the hierarchy of, yes, I am band this, I am band that, and see that you are there to learn as a student. It's there that you become more affirmed, that when you know you're supposed to be doing the medication rounds, and you know a healthcare assistant says, oh, can you do the bed? It's, you know, being able to stand your ground and say that I understand that this needs to be done. However, my role at the moment is to give medication or to shadow the nurse. So things like that, it teaches you to be affirmed, it teaches you to delegate, and it teaches you to remember what your position is as a student nurse, that you're not there to be a healthcare assistant, to be a runner, but you're there to learn from the nurses. Another thing is that because of the hierarchical system, sometimes you can feel a bit distant from management. And for me, I had to intentionally take those steps and be able to ask for time with management, where I can also have a management day, and to understand what it is to be in management as a nurse. Because in uni, although we are taught leadership, once you become a band 5, you're already a leader. You lead the nursing associates, you lead the healthcare assistants, and you can even lead a team, for example. But you, at band 5, you're not the leader of the ward per se. And so being able to sit down with the band 7, the senior sister or the junior sister, I'm able to learn how they allocate the shifts in the day, and it trains you to desire leadership. A lot of nurses, and you know, kudos to them, it's not by force to progress and become a band 7, but they stay at band 5. And sometimes, from what I've experienced and people who I've spoken to, it's not because they don't want to lead, but they don't feel adequate enough. They don't feel like they can take that leadership role. And I think that as a nurse, anyone can take a leadership role as long as they desire for it. But as a student nurse, remembering that you can, you know, be more than a band 5, you can progress to a leadership role, you can be head of nursing, you know, you can attain for those levels. And so as a student nurse, sometimes you can feel a bit lost, like I mentioned before, in the midst of everything. And I think one thing that really helped me was to always be part of the meetings. Whatever meeting is going on, don't feel like, oh, I'm a student nurse, so therefore I don't really have a say. You do have a say. You are part of the workforce. And so, you know, you're counted in the numbers. And so, you know, when there are meetings, whether it's the multidisciplinary team meeting, whether it's just a ward meeting, whether it's a meeting to discuss the patients, whatever the case may be, wherever there's a huddle, always try and be involved, because then it helps you to even be able to reflect and see where you fit in. Sometimes I remember being a student nurse and you know, I'd be counted in the numbers, or the senior sister would say, oh yeah, no, don't worry, Debbie can do it, she's been around long enough, you know. And it shows what leadership thinks of you in the team, because if you find yourself you're not always counted in, or you're forgotten about, it's something to evaluate on, and am I making an impact in the team, you know. And so that's just a little bit of advice on, you know, how as a student nurse you can make sure that you don't get lost in the hierarchical system in nursing.